Hey everyone, Eric Christensen here from MedEd 101, pharmacist, PharmD, board certified in pharmacotherapy as well as geriatrics. We've spent time preparing our 2025 BCMTMS exam study guide updates. So those are live on the website and ready to go. We do that on an annual basis. Been creating study materials for 6-7 years, I believe, somewhere in there. Very close to when this exam, this certification exam came out. So got a ton of experience following it year over year. Want to share some of the most important things you need to know for 2025. So first off, is board certification important? So you've got BPS, which has BCPS, ambulatory care, BCGP. And then you've got BCMTMS as well, which doesn't fall under the window of BPS. This is put on by the National Board of Medication Therapy Management. So that's a small distinction, differentiation. For your purposes as a pharmacist, it might be difficult to kind of decide or choose, which certification you should pursue. Whether that's ambulatory care, whether that's geriatrics, whether that's pharmacotherapy, or whether that's the MTM certification. So it is a little bit convoluted, I would say. But with that said, I think of BCMTMS as those more in community clinical spaces. So community pharmacy, performing MTM, those type of tasks. That's probably the main folks who are looking to probably get this certification. Now, if you're looking to diversify your career and go into, let's say, hospital pharmacy, for example, you've been working community or retail and you want to go to hospital pharmacy, I would probably encourage you to look at BCPS. But if you love community, love outpatient things, love community pharmacy, definitely BCMTMS might be a nice fit for you. So board certification, why is it important? In my experience so far, it's a good reason why you won't get an interview. So if somebody's board certified over top of you, you're applying to numerous jobs, you're trying to get a clinical position, work more MTM, do a little less dispensing. That type of situation, having that certification can kind of show that, hey, I go above and beyond. I'm up to date. I know my stuff, that type of thing. So that's probably the biggest benefit if you are kind of networking, looking for a different position, or down the road, you're not sure, like, boy, I really don't want to do this for the rest of my life, but maybe you're going to stick it out another year or two. Getting that certification may be a key to help getting you kind of those interviews and maybe those next steps into a more desirable position for you. So that's one reason. The other big reason, I think it's going to come with credentialing, where some states, Board of Pharmacies may require certain credentials, whether that be BCMTMS, whether that be BCPS, or they might just say one of them. So example, California, for advanced practice pharmacists, they have this designation within that state. You need to possess a current certification in a relevant area of practice. So they're saying, hey, that's one of kind of the tokens that you can have to kind of demonstrate your competency from a clinical standpoint. All right, certification here. So according to the results of a survey, most employers prefer new graduates over existing pharmacists because of the emphasis of MTM. However, employers have mentioned in the survey that they would much rather have an experienced pharmacist who possesses the skills in MTM. And obviously, you demonstrating that by exam, by getting a certification, could help you fall into favor in front of a new employer, for example, there. Certificate versus certification. I've been asked this, emailed questions on this for sure. What's the difference? So a certificate, basically you go through a course, and at the end of it, you maybe do a few questions and you get a certificate saying, hey, I passed this course, I passed this certificate program. Now, board certification is basically a standardized exam that essentially doesn't come with its own sort of study materials or course. It's basically comes with a content outline, and you absolutely must pass that exam. And the thought is that's obviously a much more highly valuable thing than a certificate program, which you go through the motions and that's that, you get the certificate. Board certification, you actually have to sit down, prove you're passing the exam, and that's what BCMTMS is. So board certification helps kind of prove, identify that you've got that training and experience. A board certification is going to be more valuable than a certificate of completion of a course. Board certification also requires ongoing standards or requirements that must be met, and usually that's in the form of CE or retaking the exam. So some of my board certifications, I've chosen typically to retake the exam rather than try to keep tabs on all the CE I do. But again, that varies from individual for sure. I would say more pharmacists probably do the CE versus retake the exam because many people don't like to retake exams. So you can do either there, certainly. So BCMTMS, so it's Board Certified Medication Therapy Management Specialist. Again, that organization is the National Board of Medication Therapy Management, who hosts this exam, creates this exam, however you want to say it. Eligibility, so licensed pharmacist, 2 years of MTM experience in retail, community, or ambulatory care. Experience criteria waiver if you have completed an MTM-approved training program. So APHA has one, for example. So if you don't have that 2 years of experience, you can get this certification more quickly by going through those MTM-approved training programs. Another option is residency, of course. Then you need to do the application. Obviously, you need to pay their fees, of course. It's $450 initially, and if you fail, which there is a significantly high failure rate, it is $200. Very, very important. Ask your employer if they will help cover the cost of study materials and the exam. That's an absolute no-brainer. Obviously, at meded101.com, we give receipts all the time to people asking for, hey, can I have a receipt to the study materials I purchased? My employer's going to reimburse it. Absolutely no-brainer. You might as well take a free $200, $400, however much you spend on study materials. No-brainer, certainly, to at least ask your employer. Many employers want their employees to be well-educated and to go above and beyond. So here's the content outline of the actual exam, which maybe many of you are waiting to see here. There's a link to that as well. So the breakdown. Pharmacotherapy is 62%. I would probably put pharmacogenomics in with that. I mean, there's a lot of things pharmacogenomics-wise that apply to pharmacotherapy and drug selection and things of that nature. So, a good chunk of this exam, probably 65-70%, is pharmacotherapy medication related. But that doesn't mean you should overlook these other topic areas. So we've got medication therapy management practice, patient care advocacy, documentation, and billing. And in our study materials, we've gone through all of those line by line. They get broken down further, each topic area. Our study materials are designed off of this versus other study materials I've seen. They basically create a program for MTM, and it doesn't necessarily match the content outline. Then you get to the exam, and you're totally blindsided by multiple things. And that's definitely what we don't want. So large content outline within that pharmacotherapy section. There you can see everything listed there. So this is a big exam. It's challenging. It covers a lot of areas. Obviously, in our study materials, we've gone through all of these, making sure that, we're giving you, the basics from a clinical standpoint, drugs of choice, things of that nature. So we've done the heavy lifting in kind of creating a study guide there for you. The exam specifically, some of the details, I think are relevant. So we have had historically higher pass rates in the past. So that pass rate was significantly down in 2023, compared to 2020. We're talking a 20% decrease there. Okay. So this is a challenging exam. It's okay to fail. I've gotten emails from folks that have not passed the exam. Maybe they didn't feel like they put in enough time, or maybe they, aren't great at multiple choice exams, whatever the case may be. Nearly half, 4 out of 10 are not going to pass this exam. So, again, one of those reasons I emphasize, if you're thinking about doing it, go ahead and give it a shot before you need that certification for something, whether it's applying for a job or maybe you're, trying to get credentialed in a state or something like that. My recommendation is, if you're thinking about it, leaning towards it, just go ahead and do it. And, you can retest. Granted, it takes more money and a little bit more time, but it's, not like failing the NAPLEX. You fail the NAPLEX, you can't practice as a pharmacist, versus you fail one of these certification exams. You know what? You're in a big boat with a lot of other people that have failed as well, and typically it's not going to your job's not going to rely on whether you're certified right now. Hopefully that's not the case for most of you, and especially if you try to get that certification maybe ahead of time before you maybe need it. The exam is 4 hours, multiple choice, 1 correct answer, 200 questions, not graded as a percentage. It's given as a scaled score. For our study materials and some of the questions there, in my humble opinion, I think, and in chatting with folks who've used our study materials, I would try to get 75% or more on our study materials. If you're able to get to that level, I think you have a pretty good grasp on the concepts, on a lot of the pharmacotherapy and many of the questions and things. So that's what I would say as far as a target to feel comfortable, like, hey, I got a good shot at passing this. Of course, finish the whole exam. You do get dinged if you don't finish a question. Another important reason why you should do some practice questions to pace yourself, especially if it's been a little while since you've taken an exam. So I think that's really, really important to do. And then, again, this very hard exam, pass rates are around 60%, give or take 5%. So anticipate that you're going to get some hard questions and some questions that you don't know the answer to. So, if you see the first 2 questions and you don't know the answers to either of them, you've got to figure out a way to get your mindset right and move forward, because there'll be a lot of questions ahead that you maybe do know. All right, a little bit deeper on preparing for the exam. Pharmacotherapy, 2 big things I tell people to remember with regards to drug selection. Understand why you would select a medication. So that could be a compelling indication. This is a guideline-based therapy. And understand why you wouldn't select a medication, whether that's, a contraindication. Let's think of bupropion in seizure disorder. Okay. Probably shouldn't use bupropion there. Contraindicated drug interaction. Maybe you're using NSAIDs with warfarin. Okay. So that's why you wouldn't use an NSAID if we need something for pain relief, if the patient's on warfarin. So again, understand why you would or would not use a medication when you're studying for these exams and the BCMTMS specifically. Now, the non-pharmacotherapy section, it is a little bit challenging, because we don't deal with those questions a ton. At least most pharmacists don't deal with those questions a ton. So again, in our study materials, we've gone through the terminology, CMRs to billing codes to, regulatory topics, delve into statistics as well a little bit. There's tons of bullet points within that content outline. And again, we've gone line by line, making sure we define all those so what some of the terminology is going into your exam. Focus on weaknesses. Good example I give to folks, okay, if you're an expert in anticoagulation or hypertension management, don't spend your time studying those for this exam. Okay, now you might need to stay on top of it and that sort of thing as far as your job goes, and that's great, and you should. But if you're preparing for the exam, you got to shore up your weaknesses. Okay, don't focus on your strengths. This is a recognize your weakness based upon the content outline. Okay, don't go studying things that don't matter. For instance, ICU sedation, probably not something you want to study for a medication therapy management, an outpatient type of exam. And then, of course, practice questions. I alluded to the timing thing, making sure you know how long it takes for you to answer a question. Our study materials from MedEd 101 are listed on the NBMTM website. I've got the link there if you want to pause the screen. Otherwise, you can just Google search BCMTMS MedEd 101 study materials, and it'll come right up for you. We've got a few different options. We've got question banks only. We've also got full review course that goes into everything that's on the content outline as well. So, again, you can find that link on the BCMTMS website or obviously, Google search it, BCMTMS MedEd 101 study materials. And just showing you that briefly, here's the National Board of Medication Therapy Management website. If you click on the left-hand side, exam prep resources, this will come up and you'll see where the third or fourth one down there, BCMTMS All Access Pass. All right, so you've taken the exam. Now, the next question I always get emailed, when will I get my results? So if you take it early in the testing window, be prepared to wait quite a while. Okay? So if you take it, so let's take the example window of May 1st. Okay, you take it first day or very close to that. So your results are going to come 4 to 6 weeks after the testing window closes. Okay? So expect it to take at least a couple months in the majority of scenarios before you get your exam results. Retaking the exam, or I guess failing the exam, is not an issue. It's not a big deal, other than you've got to reinvest your time and obviously a financial commitment as well with an additional $200. So ideal to pass the first time, but it isn't life-threatening and financially life-threatening if you don't pass, like the NAPLEX is. And then that certification is valid for 5 years. Again, the two options are CE requirements, meeting those, or retaking the exam to recertify. We've got tons of reviews. I wanted to share some of those, some testimonials. Again, we've put together content for this exam. We've updated it annually, making sure we're trying to be current with guidelines and all that good stuff. So again, tons of testimonials we've had over the last few years here. So you can pause and take a look at those if you'd like. Otherwise, you'll see some of them on the MedEd 101 website as well. And if you got any further questions on this, you can connect with me on LinkedIn. Eric Christensen, PharmD, BCPS, BCGP. mededucation101@gmail.com is the best way to contact me. And then there's the link, direct link for the study materials as well. Thanks so much for listening. I hope this helps you prepare and plan for your BCMTMS exam in 2025.